I guess this is for Dr. Walensky or Dr. Fauci. What is the point at which we'll know how transmissible or immune evasive the Omicron variant is? Is there a certain data point, or is there a certain number, the share of infections we should be seeing? When does that become clear just how bad this thing is? Thank you.
Dr. Fauci, why don't we start with you?
Yeah, there are two phases to that, Dan. One is to take a look when we get the virus in a form to be able to use it as a parameter of antibody neutralization. The other is a much more easily usable one called a pseudovirus. And what you do is you get the sera from people who've been vaccinated, people who have convalescent plasma or monoclonal antibodies, and you measure the capability of those to actually neutralize the virus. Then there will be the clinical indication. That would give you a laboratory prognostication of what you might expect. But then clinically, when you follow, and right now, the South Africans, as we mentioned, because of the volume of cases that they have thus far, are ahead of us in the sense of being able to take a look at differences in protection, immune evasion, severity of disease in people who have either been vaccinated, people who have been unvaccinated, or people who have recovered from prior infection. That's all going to take a matter of maybe a week or two more to get the in vitro data, and maybe another additional week or so to get the clinical data. So we expect we're going to have that information to you over the next few weeks.
Next question, please.
Cheyenne Haslett, ABC News.
Hi, thank you. Along the lines of the last question, are we setting people up for sort of a false deadline? Do you think that there will be a moment in the next few weeks where we really have a clear picture, or is it going to take months before we know if Omicron is going to become a dominant variant in the US?
Dr. Fauci?
Well, you have a couple of questions there. The first is it's going to take a while for us to know what the impact is going to be globally and for people who are infected with Omicron. The way you find out whether it's going to be dominant, and the CDC will be able to do that as they continue to follow the percentage of the isolates that are Omicron and the doubling time of that percentage. You might recall months ago, when we had 1, 2, 3, 4% of our isolates were Delta, and then we were able to project, and the CDC did do that accurately, to project how long it would take for it to become the dominant one. So we really don't know what's going to happen, how well it is going to compete or not compete with Delta. But we will know as more cases occur and what the doubling time of the relative percentage of Omicron versus Delta will be.
Next question.
Let's go to Rachel Levy at Politico.
Hi, thank you. This is a question on the new rules around testing and insurance reimbursement. Wondering if you could clarify essentially why we are going to have Americans getting reimbursed by insurance, and especially after the holiday surge, wouldn't it make more sense to have the testing essentially be free? The rapid tests that we can buy at the store now are quite expensive, and ahead of the holiday season and increased travel.
So the core of our strategy here is convenient tests where and when they are needed. And we want to make sure we get Americans tested in the most efficient, convenient, and effective way. And thanks to the strong actions that we've taken across the last several months, we have plenty of testing capacity, including increasing availability of quality free tests, at-home tests. These are available now. And yesterday, the president announced additional actions. As you mentioned, more than 150 million Americans on private health insurance will be able to submit receipts for at-home tests directly to their health insurance plan, so they can go in their local pharmacy, they can order online, and then get reimbursed. For those that don't have private insurance, we are making available, starting this month, free tests at convenient places in their communities, like health clinics and community centers. On top of that, we have 20,000 sites around the country, many pharmacies, schools, libraries, health clinics where people can walk in and get a free test. And so since September, supply has really cranked up. We've quadrupled the supply of at-home tests. The FDA has, in fact, authorized 5 new over-the-counter tests. So we now have a total of 8 on the market. So there's consumer choice and prices are starting to come down. That's up from 0 tests that were on the market when the president took office. So the bottom line here is hundreds of millions of Americans have access to free tests through their insurance, pharmacies, schools, libraries, and community health centers. And the core of the strategy is to make sure the tests are where they are needed and available when they're needed at convenient locations. Next question, please.
Let's go to Meg Tyrell at CNBC.
Well, thanks. I'm wondering, obviously it's too soon to know if we'll need to update the vaccines, but in the event that we do you anticipate that the new vaccines would be the Omicron spike, or would they be some, sort of combination designed to confer broader immunity toward potential multiple variants? And how would that be decided? Would it be similar to flu vaccines where the strains are given to the manufacturers, they're told what to put in the vaccine so it's uniform? Or would the manufacturers be making these decisions themselves and therefore it could be potentially different? And then what does the regulatory process look like? Would it be similar to boosters where they could be cleared based on antibody data?
So Dr. Fauci, why don't you get us started there? And I think it's important, Meg, to understand that this is a contingency plan that is being developed, that in case we do need an update to the booster or the vaccine. But it is very much a contingency plan. Dr. Fauci?
Yeah, Meg, so the situation is going to be actually multifaceted. And by that, I mean, the data I showed you on my brief presentation indicated that we could probably get a good bit of mileage just from boosting with the ancestral strain vaccine that we already have for the reasons that I gave in my presentation. But having said that, we are working with the pharmaceutical companies, particularly obviously Moderna, Pfizer, and J&J, on what their plans are. And they do have plans that have multiple contingency. One is to rev up the production of the vaccines that they already have. The next is to make, for example, a bivalent, where you have a vaccine against both the ancestral strain and the new variant. And the other is to make a variant-specific boost. The degree to which they're going to be doing that, they are now assuming they may have to do that and are being prepared for that. With regard to the regulatory issues there, I would have to defer that to the FDA, but in general, it could, and I say could, fall under the same situation as we do with a strain change for influenza. But I would have to leave that determination to the FDA.
And just to build a little bit on that, the FDA has laid out guidance for the manufacturers, the vaccine manufacturers, to understand how the agency will evaluate and expeditiously address the potential impacts of a variant on the vaccines, and how the FDA will move quickly and at the same time maintain its rigorous scientific standards. Next question.
Last question. Let's go to Nate Wexel at The Hill.
Hi, thanks for doing this. Just to, I'm curious about the timeline on the travel restrictions so far. It seems like there is community spread right now in the US. It seems like some of these cases were here before the restrictions on the African countries were put in place. Is there a timeline for lifting them? Is there, any sort of, what's the next step there?
So, as we've talked about throughout today's briefing, we are actively monitoring the new variant, addressing the questions that have been raised about transmissibility, severity, and vaccine effectiveness. And as we learn more about the variant over the coming days on all of these fronts, decisions on changes to travel policy will be based on the advice, as they always are, of our health and medical experts. We'll continue to rely on their expertise regarding how we make sure that we keep the American people safe, and that will directly impact the duration of these travel restrictions. Thank you, everybody, for today's briefing. We look forward to seeing you next week.